Hi everyone, Sue here, and I'm just going to apologize in advance that I hope that this will be a quiet recording, but my little dog who thinks she's a Great Dane has been eagerly barking at little blades of grass blowing in the wind or leaves that rustle by. So if she barks, I apologize in advance. And also, it's just been a little bit chaotic, phones ringing, other things. I think I've got it under control, but I'll do my best. The point of this overview is just to give, I'm getting some questions about the critical appraisal assignment. So I thought I'd just go over it with you here so you have an understanding of what to expect. And I've also uploaded some other resources for you. So let's start just with the basics. Due November 15th to the Dropbox, and it's worth 25% of your course grade. And as always, if you have a conflict, if something is going on, could you please just get in touch with me? Good communication is something that I hope to follow through with, and I always fall down, and I understand when other people fall down, but I'll do my best if you do your best as well. So again, 25% of the course grade, and a critical appraisal is really important for a research course because it gives you opportunity to engage in the steps of research, and that makes things seem, I think, to make sense. It gives you a sense of exactly what that researching process involves through the idea of being a consumer of research. So how do I use research? How do I appraise or determine the quality of research? And so through that, that becomes actually the level at which a graduate of a BSCM program should be able to work with research, that consumer of research, be able to appraise research effectively. Not necessarily become a research, but understand those research steps and what is the importance of the kinds of activities that you should be involved in. This assignment is tied into several of the course outcomes, number 1, number 3, and number 5 to 8. And so it's always important that we don't just teach what we want, but we teach you in a way that meets those course outcomes. That is our promise to you and also to the College of Nurses and the Accreditation Board, that we have done that and made that the link between what we were supposed to teach and what we are actually evaluating. And so through this assignment, we're looking at outcomes 1, 3, and 5 to 8. This assignment actually gives you a great opportunity because I know you've got it, right? You've got this. You have this capacity because, you know what, we as nurses, one of the most important innate qualities we have is that we have this spirit of inquiry. We are interested in finding answers to questions that emerge all the time for us. And this assignment really hones that skill for you. And so it really allows you to demonstrate that you have developed the following skills or abilities. The first is to be able to identify and articulate a clinically relevant and significant research question. And lots of people are asking me about questions. Do you remember we said this has to be related to nursing, right? So if you said, is radiation therapy or chemotherapy better for the treatment of stage 3 metastatic breast cancer, blah, 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 more detail is needed there. That is an important question, but do you see how the focus, that's a much more medically oriented question, although nurses are interested in treatments. In this assignment in a nursing research course, we really want you to investigate a nursing related phenomenon. And it was interesting because the other day I had a student say, does that mean I have to put nursing in the question? And it was a great question because her topic was very nursing focused. But other people, other kinds of professionals would also be contributing literature, research to that topic. And so were she to use the term nursing in that search, it would have been actually less effective. So it doesn't mean that you have to include the word nursing in the search, but you have to say to yourself, is this a phenomena of interest specifically in the context of nursing practice? Okay. And so you want to be able to figure out what's clinically relevant. It's so great if you can just look at your environment, where you work, the kinds of things you've seen. The best assignments are usually written by people who look at their work environment, things that they've noticed that they're curious about, as opposed to thinking, what can I recycle from another course? What have I learned? What can I, build on? Of course, you can't reuse any material. But if you're interested in something, I think then the search process becomes much more valuable to you. And you walk away hopefully with information that you can bring back to your work environment, and you can see how this is really clinically relevant. So develop that question well, and you can use, and then you're going to frame it using one of two approaches. We're going to go through all that. Pico or Spider. Pico, and you can use either one for qualitative, Pico or Spider. For quantitative, you use Pico. So you're going to develop that question and you're going to frame it according to that method. And then you're going to conduct a search for the best available literature. And so you're going to go through the actual process of doing a well-defined CINAHL search, not a Google search, not even a Google Scholar search, not a ProQuest search, but an actual CINAHL search. You're going to find the best available articles. That doesn't mean the first 3, but the best available. And again, we're going to go through all of this. And then you're going to appraise, so evaluate according to specific criteria, each of 3 best articles that you find, and you're going to synthesize your findings. So you're going to bring them together. If all of the studies come to the same conclusion, then you would say the evidence from all 3 studies said this. If they come to different conclusions, then you might say 2 out of the 3 studies demonstrated there was efficacy. The 3rd study questioned whether it would make a difference to add a different modality, something like that. So you see, they may all say the same thing, or they may say different things. And it doesn't mean you have to find 3 studies that say the same thing. You want to find the 3 best studies, and then you want to synthesize those findings. So let all of those studies speak. That doesn't mean you write like a paragraph about study A, a paragraph about study B, and a paragraph about study C. It means you work with them together. So cohesively as one unit, what do those 3 studies that you found, or the 3 articles that you found, research articles, say about your phenomena? Okay, so this is just some technical stuff, and you can read it. This is all from your syllabus. It follows the first step, evidence-based nursing practice process. And so we've developed a template, and thank you so much, Charles Anyanam, who really is the lead here in such wonderful ways, has developed a template for us to use, and I'm going to go through that. And here are the steps. And again, you can read this, but it's basically cultivate a spirit of inquiry and ask clinical questions in Pico format. And again, I said, or Spider. Step 2 is search for the best research evidence, and that's what you're going to do. Step 3A, select the best available evidence and critically appraise. So best available, remember that means you may look at 25 different articles and you have to justify, why am I picking this article as the best? Is it a higher level of evidence? Are there more participants? Is the philosophy consistent with the study? Other things, so you want to read it well to see if it makes sense. 3B is to synthesize the literature. Remember we talked about that. Step 4, integrating the evidence. Remember we talked about that. Okay, so pretty exciting. Let's go right up to the top here for a second. Here is the format that you're going to see in that template that's loaded for you, okay? And this is, I think, helpful because it gives you a sense of exactly how every section is evaluated as opposed to writing a traditional paper. So you're going to find your research question. Remember, that's the very beginning. And again, use the format, please, that's included on the very top box. You're going to find your research question. And sometimes you have to play with it a bit to really figure out, how do I fit that into my Pico, or how do I fit that into Spider? All right, and I'm just going to go down for a second. Let me make you dizzy. To remind you, and I'm sorry, I've got a typo here. Pico is population or patient problem, intervention, comparison, outcome, and we don't always have time, but sometimes we do. Spider is and Pico can be used for qualitative or quantitative. Spider is the one that we use for qualitative research, and that includes an understanding of sample, phenomena of interest. What are we interested in understanding? The design, the evaluation, and the research type, right? So what type of research was it that they undertook? All right. So either one of those is one is fine for qualitative. If you're doing quantitative, Pico is the format you use, but you don't always have to have a T, and sometimes there's not a C. So back up to number 1. It's worth 5 marks out of 100. And you just have to take that question and put it into that format you want, Pico or Spider. and you get 5 marks for that. So you want to do that really well. Make sure you understand what the different elements are. Number 2, you want to briefly describe how this thing that you're looking at, this research question, connects to nursing practice. So how is this significant? Why do you want to look at this? Why does it matter to nursing? Okay, and it's worth 10 marks, so 10% of the assignment is maximum 250 words. That would be about the length of a double-spaced sheet, so maybe 2 paragraphs, 2 solid paragraphs or so. But you want to really justify, why is this worth exploring? And I'll give you a really good example. Sometimes students want to explore something like, does hand washing decrease the rate of infection? And the bottom line is, that's old, that's stale. We know it, it's not worth researching. There might be some specificities of things, but typically you want to be able to justify why it's important. There's an increase, let's say, there's an increase in, I don't know, increase in hypertension in teenagers, often associated with lack of daily activity, limited daily activity, and increasing adolescent overweight and obesity. So we could frame a question that relates to the relevance of that. So does increasing level of activity, blah, 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 impact blood pressure in adolescents who are overweight, or something like that? We could, do you see how you could frame it? But then I need to justify, why does it matter? Well, it matters because. And in that case, I can look at the literature from the studies, but the general literature as well. For determining the answer to why something is relevant, often one of the things we want to look at is how prevalent something is, so how common it is, or even if it's not common, how significant it is, or how, sometimes we look at a patient condition or a patient treatment, nursing interventions, but sometimes we look at things like nursing experiences or patient experiences and other things. So in our justification, we look at our very specific question and we determine, how is that relevant? Why are we bothering to do this? And we use literature to support that justification. Why does it matter? So if we go back to COVID, why does it matter if we reuse masks 20 times or we dispose of them after the first time? How is it that we know we can recycle them 10 times, but not? How do we know that there is not microbes settling on the mask in a paper bag that are being retransmitted when a person lifts it out? How do we know all of those things? That would be relevant to practice. We developed that question well and could do a search because it's about safety, both for nurses and patients. So however you define your question, the next step is to take some time thinking about, why does it matter? Why is it relevant? Then this is exciting, the CINAHL search. And honestly, I love it. It's so critical that you want to do a really effective search. And I think for all of us, we often get a little bit sloppy in our searching, so that we're using and or, but we're not necessarily capitalizing, or we're not necessarily using brackets. There are things that are called truncations or wildcards. So I'll give you an example, and I bet you already know this. I'm sure you guys are much more adept than me, but let's say I wanted to study something in women, but I could have women with an EN, or I could have something that is one woman, would be woman, W-O-M-A-N. But I don't want to have to do like put women and or woman. I could just do W-O-M and an asterisk. And that asterisk is called a truncation. So that means that I can move from, so it can search for articles that begin with that, the beginning of that word, but not so much specificity. And you'll find that in many, helpful in many ways. So for example, if you want to do something plural and singular, you could just put a truncation at the end of the word rather than S. Because when you use the entire word with an S, for example, that means that in your search, it's only going to look for a study that has multiples. But in a qualitative study, you can actually have case studies with only a single of something. So if we wanted to use the word participant, it could be participants' experiences of undertaking play therapy for stress, or participant. If it was a case study and I only wanted to do write up one participant, then I could use participant. So the way to differentiate that and not have to double search or miss out on some of the literature is at the end of participant, put that asterisk, which is a truncation. And that means that if it ends in participant or it goes on to an S or something else, all of those will be included. Now, what I've done is loaded for you a PowerPoint and also a voiceover PowerPoint, which is the old-fashioned way of doing something like this. So I appreciate your patience. Just doing my best to bring the best that I have to you to help you with this. It's a little bit tedious, but once you know it, you'll be so good at searching. I know you'll say to yourself, I can't believe I didn't know this from the first year on, because it is so helpful to do a very well thought out search that's nested. And you'll see that in the presentation, that enables you to find everything you want with one search instead of doing multiple searches. And so you're gonna have learned how to do that search, use that search strategy. And then what you're going to do is enable us to see how you used it, right? And the way you're gonna use it is by indicating what database. Now, if you found, you have to at least use CINAHL, at least do it in CINAHL. You may find everything you want in CINAHL, and then you can go on to others, ProQuest, other things, if you don't find enough. If you find nothing in CINAHL, then you just say you did nothing, all right? But CINAHL is really the premier searching source because it is so well organized. Now, the frustration sometimes is you don't have full text on everything. I would just caution not to limit to full text because sometimes you can get articles through other sources. But anyways, it will be important to start with CINAHL before, for sure, show me that search strategy in CINAHL before you would move to anything else. And in that search strategy, you'll see from those PowerPoints how you lay it out. What are the terms? What has brackets? What uses and? What uses or? What uses truncations? And how you nest things with smaller fields within a larger field. Don't worry now if this makes no sense, because you're going to look at that PowerPoint and the voiceover PowerPoint and you're going to know how to do it. So for 10 marks, you're going to figure out how to do that search strategy using your question. It comes right out of your question. And that's why PICO is so effective. It really supports you then in moving to that search strategy. And then you're going to show me how many results you got. So let's say I did my strategy and I got 5,200 results. Sometimes you ever get like 27,000 results. That doesn't tell me I should start looking at them. That tells me my search is too broad. My question is too broad. So you don't just say, oh, too bad, I got too many questions. Next time I do a narrower search. The expectation is actually then that tells you, that's a key that tells you I need to narrow my question. To do a good critical appraisal here, I need to narrow down my question. I could narrow it down by another factor. So for example, I could add an age-based factor into something, narrow the age range of something I'm trying to observe for, or gender-based, or all kinds of things. So depending on what you're looking at. If you got only a few results, so for example, the results over here say 16 for the search that's been done, and you see the search strategies indicated, 16 is few. If I'm only getting 16, that might be good because it might be something new and emerging, and so I just have a small number of articles. It may mean that I might have to broaden a little bit my search, right? So not narrow it as much. So you're going to want to look at the quality of those articles to see. That work going back and forth is important. It's not just fishing around for anything. It's actually refining your search based on what you see. Until you put your toe in the water, you don't know how warm it is. So that's an important process. Don't get frustrated going back and forth. This skill will actually help you to become a much better searcher. And then we're moving on to this critical appraisal, right? So you're going to find from your searches, they don't all have to be from the same database, but remember, you have to at least show me your search in CINAHL. And then you can show me searches in other databases if there wasn't enough in CINAHL. But in order to critically appraise, you have to assess that article, and there's a systematic approach to assessing that article, right? And this is what we want to see. And again, we've kind of laid it out here, I think, for you perfectly, how those 45 marks are made up. And the maximum length here for each of those studies is 250 words, again, like a page. So first you're going to have APA 7th edition perfect formatting. You know, do you ever click Cited? Cited is great as a starting point. It is most, maybe 50-50, I don't know, correct, not correct. Mendeley is actually more correct. I'm not sure if you have access to that, but really you need just pull out that 7th edition or look it up because you don't want to lose marks for nothing. So perfect formatting. And then we want just a very short 100-word summary of the research report. This was a study conducted in 2016 that looked at the efficacy of using warm blankets versus warmed IV solution in hydrating neonates born outdoors in wintertime, something like that. And so, and the result, it was quantitative analysis that looked at hospital reports from 2015, January 2015 to, let's say, February 2016. A total of, I don't know, 99 cases were reported, 56 that had been warmed with warm IV solution, 44 that had been warmed with warm blankets. The results found blah, blah, blah. So you see 100 words, summary, overall. That's not analysis, it's summary. So that's high level, you're summarizing what's in it. And then you need to move to the critique, right? And so the critique or the critical appraisal asks you a couple kinds of questions. Break down the article. First, what is the level of evidence? Now, the first version of this chart had 7 levels of evidence, which are commonly used, but in your readings, they had 5 levels of evidence. So you can use your readings for sure that referred to 5 levels of evidence, and we've revised the form for that, or you can use the 7 levels. And then you're gonna look at the type of research study. Is it quantitative? Is it, and if it's quantitative, is it one of these things? Is it a meta-analysis? Remember meta-analysis, you bring together a whole bunch of studies and have an overview. Is it a systematic review? Do you remember that's high level evidence? That's a very specific procedure for looking at searching out a variety of sources to answer a specific well-defined question to see what research is already available. It's not, you're not conducting new research, you're finding the research that's available. Is it experimental? Or is it quasi-experimental or cohort? So it's important to determine what kind of research it is, or if it's qualitative. There's a variety of qualitative research methods here. So is it a phenomenological study? Is it grounded theory? Is it descriptive, qualitative descriptive? Or is it ethnography? So those are just ticks. You're determining what it is. And then you're going to spend a maximum of 250 words describing or analyzing that, that study, right? So the level of evidence is really important. And then, looking at the kind of research that it is, and then looking at the way the study was conducted. Is it well described? Is it well defined? Are the characteristics and the components identified and defined and made clear to the reader? Is the method consistent with the question? All those things. So you're going to critique that, and then what do the results say? Do they have enough evidence to support the results and their recommendations? There's a lot of things you're going to look at in that, but it's in 250 words. And remember, you're going to go through this for your three best articles. All right? The 3 best, not the first 3 you found. It doesn't have to be 3 from different sources, like different databases. It's the 3 best. The 3 best. Okay, and then, so that's your 45 marks for doing the critical appraisal of those 3 papers that you've chosen. And then you're going to bring those, so now you've done those appraisals, there's individual appraisals of each of those 3 papers. You're going to synthesize those, right? You're going to bring those together, and I talked about that a little before. That doesn't mean you're just summarizing this study found one thing, another study found another thing, but you're bringing together those ideas so that they make sense and so that your voice is heard in how you are analyzing what you found in the different research articles, right? So it's like putting the pieces together in a new way, but your voice is important in this. 20 marks for that, and maximum 500 words. So that would be the equivalent of 2 pages double spaced. And then finally, the last 10 marks is to think about this again. How is this important to my practice? Right? What recommendations would I make? And how would how does this impact what I would do in the future? When you look at the quality of the evidence that was available, maybe you had a fantastic question and there was some available evidence, but there needs to be more study, you would really talk about that. Implications, but there needs to be more research, or how these findings either support current practices or refute current practices, say we should be doing something differently, right? And then you determine what recommendations you would make for practice, for nursing practice, based on your analysis. And so that's, again, 250 words, so 1 page. So I'm just going to remind you, here are the elements. Develop your PICO question, right? You're going to think of your question, and you're going to use either PICO, with or without the T, for qualitative or quantitative, or if you choose for quantitative, you can use SPIDER. You're going to for 10 marks, 250 words, describe the relevance. Why is this question important? And you're going to use literature to support that. You're going to complete a search strategy. There's resources posted for you there. This is worth 10 marks, so 10% of the assignment is actually marks you get for doing the research part alone. But you need to actually include your search strategy. And there's an example of how search strategies look, right? Do you see that? And there's many components. They don't all have to be complicated as that, but a search strategy that really is explicit, using a nesting, which is putting things in brackets, so that one thing is considered together or separate, and then it's part of the larger search. Using and or, you might be limiting dates forward, you might be limiting English. So however you limit it, looking at your population and determining from all of that, and or truncations and wildcards, determining from that what your results are going to be. So what results do you get from your search, and what do those results tell you? Remember, if you get thousands of results, your search question is too broad, you need to limit it in some way. If you get only 1 or 2 or 5 or 10 or even the 16, I would suggest, now it depends on the quality, it might be an emerging phenomena, but it might be that you would need to broaden your question a little bit because you're just not getting that many that many results. Okay, and absolutely everyone has to show me a CINAHL search and show me their results in CINAHL. If you're not getting enough in CINAHL, or you really, it just is not giving you what you need, in addition, you can move on to ProQuest, or ProQuest typically would be the other one, but start with CINAHL. Really, it is a superior database. Okay, then you've got 45 marks coming from doing those critical appraisal. You select 3 articles, and each one is worth 15 as you work your way through. Perfect APA referencing, 100 words, so like just over a third of a page, summary of the research. What does the article say? What does the research report tell you? And then you're going to do the critique. Start by identifying the level of evidence. Go back to your readings, page 54. The type of research, whether it's qualitative or quantitative, and what type. And then that synopsis of your critical appraisal, right? So you're looking at this and how do you critically appraise it? Maximum length for that, for each one, is 250 words. So you've got this little process to follow for 3 different articles. All right, there we go. And then you do, for 20 more marks, synthesis of your appraisal. You've got those 3 appraisals that you've written. You've really got into the literature on the articles you've selected. You're going to then bring those together. What is the answer to your question? What do those 3 high quality articles tell you about the question that you asked? And you're not just going to summarize, but it's a synthesis which brings the ideas contained in those studies and findings together in a much more meaningful way. It doesn't mean that they're all the same, but they need to speak to each other. All right. And your voice is really important, your own analysis of that. And finally, for the last 10 marks, you're going to really reflect on what are the practice implications and recommendations that come out of this critical appraisal. Importantly, this really helps to understand why the question is so important to be a nursing question, because this is for your practice or nursing practice. What are the implications? Okay, I think we've got it, as usual, a little bit too long, but I hope that is helpful, and I hope that as you move through your assignment, even in moments where you may be frustrated, that it really is an assignment that allows you to build skill in a really important way. And I really look forward to reading these. So I hope that's helpful, and I'll talk to you soon.